Hi, my name is Professor Adam Winstock. I'm a consultant psychiatrist and addiction medicine specialist and also founder of the Global Drug Survey. In this video, I want to explain to you what doctors do when they detox you from alcohol. So alcohol withdrawal is thought to be due to the fact that there is no longer all of this alcohol about increasing all this GABA activity in your brain, which is slowing your brain down. And as a result of this, you've got all of these excitatory neurotransmitters, predominantly glutamate, floating around your brain. That's what gives you all the withdrawal symptoms and makes you feel so dreadful. What doctors do to counter that is to prescribe drugs, most commonly benzodiazepines, drugs like Valium, that suppress that glutamate activity and calm everything down. Now, different people require different amounts of medication, and they also require that medication to start earlier, sometimes rather than later after people have stopped. Hopefully, your doctors assess you very carefully so they know how soon after you've stopped drinking those withdrawal symptoms start. Now, in many places, they'll say to you, you can't start on medication for alcohol withdrawal if you're still blowing above zero on a breathalyzer. That's actually not true. If you're someone who's really physically dependent on alcohol, you can still go into alcohol withdrawal while you've still got alcohol in your breath. So treatment's not based around whether you've got alcohol in your system. It's actually what you're like. Doctors often use withdrawal scales. Sometimes they're called the AWS, sometimes they're called the CWAR, and these things are an objective guide to measuring things like how sweaty you are, how restless you are, how agitated you are, how much you're shaking your hands, and they can guide the dosing of medication. Now, I can't tell you about how much medication you'll need, and so everything I'm saying here you need to confirm with doctors, and doctors will have their own regimes. But what I would say to you generally, based on having treated thousands of people with alcohol withdrawal, is that if you're someone who wakes up in the morning or is woken early in the morning shaking and sweating with alcohol withdrawal symptoms, your starting dose of Valium might be somewhere like 10 or 20 milligrams of Valium, and that sort of dose might have to be given 3 or 4 times a day. I think a very useful guide for most people when it comes to managing alcohol withdrawal is to find what dose of medication someone needs in that first 24 hours. The next day, use that exact same dose, divided in 3 or 4 doses, and then to reduce that dose to 0 over the kind of next 5 to 7 days. If you're someone who can kind of get through to late afternoon before you start feeling uncomfortable, the doses of medication you might need might be much lower, perhaps 10 milligrams 4 times a day of Valium or equivalent, and then again on day 2 the same dose, and then those doses reducing to 0 over the next kind of 5 to 7 days in kind of 3 or 4 divided doses. There are some other things that I think are really important to think about. Sleep is a huge issue for people coming off alcohol. It's often one of the reasons people relapse. But lots of people who drink also drink lots of tea and coffee. When you're detoxing from booze, you need to avoid caffeine-containing drinks. You don't need anything else to make you agitated, anxious, and not sleep. So you knock tea and coffee on the head. In fact, you might want to think about reducing your fluid intake before you go to bed so you sleep better. Calming sleep teas and things are obviously really good. Now, you may not feel like eating when you're coming off alcohol. People can feel quite sick, and in fact, if their withdrawal's not well managed, they actually might find they're throwing up and they get abdominal cramps as well. So as much as possible, trying to maintain a good diet before the whole process starts can be useful. But certainly maintaining food intake and staying well hydrated with kind of, water, milk, juice, that's also really important. The other thing is just to accept that you might feel a bit wiped out, a bit tired. If you feel really sleepy after the dose of medication you've got to treat your alcohol withdrawal, you actually might be on too much, and it's worth discussing that with the people who are taking care of you. The other crucial thing here is that once you start medication like Valium type drugs for alcohol withdrawal, you must not drink. Combining alcohol with those other drugs increases your risk of overdose and is only going to prolong the withdrawal. I also wouldn't advise combining drugs like Valium with other sleeping tablets. The whole point is to give medication that gradually allows your brain to re-normalize. At the end of 5 or 7 days, the majority of that physical discomfort and the emotional distress will feel much better. But things like sleep and your emotions, that's going to take several weeks to return to normal. And for some people, persistent insomnia, falling asleep, staying asleep, can be a real driver to return to drink. People can also experience very weird dreams, their emotions can come flooding back. But what I need to say to you is that by interrupting that recovery process, by drinking, you're going to undo all the good work that you've done. I don't think there are any other effective, reliable medications used in most countries to treat alcohol withdrawal. There might be doctors doing this who are aware of other medications that have been tested, but the bottom line is there is nothing that is more effective than a decent dose of Valium or similar sort of drug given in the same way. Why might you be given a benzodiazepine drug other than Valium? Well, if you're someone with liver failure, actually diazepam gets broken down by your liver and the metabolites might float around too long, and so some doctors might choose to use a different, shorter acting benzodiazepine like oxazepam. If you're someone with a history of seizures or fits, I don't think there's much value of starting anti-seizure medication. What you need to do is ensure that you're being given big enough doses of benzodiazepines to suppress the risk of seizures. The peak risk of seizures is around 24 to 48 hours. DTs, this very uncomfortable confusional state characterized by confusion and delirium, hallucinations, kicks in at about day 2 to day 3. And certainly if you're at home having home detox, looking after someone, and that starts, you need to get yourself to hospital. Alcohol withdrawal, when it's spotted early, there's planned treatment, you get reviewed and you've got someone to look after you, can be a really easily managed process and an outpatient process. You don't have to go to hospital. There are cases, of course, when being in an inpatient unit are advisable. If you're someone who has a history of fits or DTs, severe physical illness or psychiatric disorder, or simply have a home environment that isn't stable or that's too chaotic, or where your experience of going through withdrawal is going to be too disruptive, then clearly being within a hospital setting or a detox setting can be really helpful. But the truth is, when you leave hospital, you're going to be going back to that same environment. So detox is the easy part. Staying sober, that's much harder. And that's what we're going to cover in the next couple of videos.